Are you looking for professional training in forensic mental health?
Hi, my name is Michele Galietta, and I'm a clinical and forensic psychologist here in New York City. I have a PhD in clinical psychology and a fellowship in forensic psychology. I do a lot of evidence-based training and research on evidence-based interventions in correctional and forensic settings.
DBT provides a really rich and flexible way to formulate cases, and so part of the adaptation is how you devise your structure, your treatment targets, what skills you put in, what examples you use. But the other part that's very, very important is if you're doing comprehensive DBT, using a formulation, and that's how everything becomes targeted to your population, to not even just your population, to your individuals. But we're going to start with, as I said, a review of the basics. So DBT as a theory, right, is cognitive behavioral therapy plus some other stuff. So the cognitive behavior therapy, right, is this side of a triangle. I like to think about DBT as a triangle because it's solid and it's kind of balanced, right? And so basically, these two competing principles are balanced. All right, so DBT is not CBT with a little bit of meditation thrown in. DBT is a staged treatment. So this is the theory that Marshall Linehan developed, and what was pretty revolutionary at the time was this notion of pre-treatment to commitment and agreement, that we don't start teaching skills, we don't start targeting behaviors until we have a very clear idea of that grappling hook of what is your goal, what's your life worth living, what is most salient or meaningful to you, and how is that related to the treatment targets, or to, because we can always weave in the mental health goals of staying alive and engaging in pro-social behavior to a functional life goal of our client, okay? So the only goals that we wouldn't support are those that are illegal, immoral, that we couldn't personally support. Typically, when DBT is successful in a place, staff morale and staff cohesion increases and staff morale increases and burnout reduces. So oftentimes you'll say to people, I don't want to be on that unit, I don't want to send me anywhere but to the ladies, that's terrible. And then they see a few really difficult patients turn around, and then it becomes a desirable place where staff want to work.
To learn more about Concept's professional training opportunities, visit us at concept-ce.com.